Welcome to the show. I'm Tosh Taylor, and there's no Jenna Morton today. It's kind of awkward to not have someone to throw it to, but alas, Jenna is not in studio today, so I'll be doing the show by myself. Today, I am having a wonderful conversation about kids and the dentist. I don't know how we've gone 4 years on this podcast without ever talking about this before, but my girls have been making a lot of trips to the dentist lately, and I thought it was time that I got some more information. So I brought in dental hygienist and instructor at Oulton College. This is Alison MacDonald. Alison, thanks for joining me.
Thank you. Glad to be here today.
So maybe let's start off with you. How did you decide that being a dental hygienist is where you wanted to go in life?
Well, long story short, I had actually, through my schooling years, always wanted to be a teacher. And so when I was in high school, I remember my dad came home one night, and a friend of his, whose wife is a dental hygienist and still practices here in Moncton, he suggested that I think about that profession. So I looked into it and thought, yeah, you know what, I think I might like to do that. So I kind of changed my path within my plan to be what I was doing in university, and went on to Mount Allison, did my undergrad, and then went to Dalhousie University to take dental hygiene. And 20 years ago, I graduated from dental hygiene at Dal. I love what I do. And in those years, about 5 years in or so, I had an opportunity to start being a dental hygiene instructor, clinical instructor at Oulton College. And so that has led me into a teaching path actually as well. So I kind of feel like I get the best of both worlds.
Yeah.
And as well, I still work in private practice, which I thoroughly enjoy as well, a little bit part-time, and to kind of keep my hand in that as well. So
yeah, and keeping up with the know, right? It's best to have an instructor that actually knows, has 2 feet on the ground.
Right.
Yeah.
True. Yeah. Exactly. Yeah.
That's interesting. Now you have a couple of boys yourself that are close to my daughter's age.
Yes.
So obviously you started them going to the dentist quite young.
Early. Right.
Is there an exact age when kids should start going to the dentist?
Good question. It's something that, depending, as a parent and as a hygienist, I really encourage my patients to look inside their child's mouth on a daily basis. The first teeth erupt around 6 months of age or so, and so oftentimes you're going to see, if there's something that the parent feels that doesn't look right, maybe a discoloration or a spot, call up your own office and say, I'd really like to, have my child looked at. And then, but continue to monitor them as more and more teeth come in. The other thing, I guess, is that important to that is that, kids can't tell us if they're feeling something, necessarily, or they can't express that. And so that becomes something that we as a parent have to keep in mind and really, observe, check inside your child's mouth. I do encourage and teach parents as well that we want to be brushing our child's teeth every day. To hand a toothbrush to a 2- and 3-year-old, they don't have the skill to do that, and so we have to be that person to get in there. But around age 3 is a good age for them to come in to have a checkup and cleaning done. And depending upon the child, some are very cooperative and will sit through a full cleaning appointment, have a checkup. Other children, that may be a little too much, and so we just take it step by step. Sometimes the first appointment is simply a ride in the chair, and that's what they can handle. That's good. And then the next time they come in, we just do a little bit more, if we're able to get a peek in there and have a look, and then if there's anything that needs to be addressed, it can be done so.
I like that idea, because I think as parents, we put a lot of pressure on ourselves too, right? To think, like, I booked your first appointment, open your mouth.
Right, exactly. Right? That's right. Yeah.
But I can imagine that a lot of dentists are just like, no, this is totally fine.
This is fine. Yeah. Oh yeah, for sure. And I think having at home, if parents, grandparents alike, and brothers and sisters and if the dental if dentistry is talked about in a positive light, that very much helps a child coming in for their first appointment, because we as dental professionals want to make it a happy, fun time, and we want them to leave there with a smile on their face. And to leave there and get a new toothbrush and a toy from the toy box or prize box, that's what they will remember. And so we don't want them to get upset and that. So that's why we sort of take things step by step according to what the child can handle. And so in that regard, you're having your child happy about going, that they'll remember those little things, that they got the sticker or the prize or the new toothbrush, that to want to come back again.
Yeah, exactly,
Yeah.
exactly. And I know my daughter's got bouncy balls the other day, and it was the best thing,
Yeah.
the best thing
Right,
ever.
yeah,
So
for sure.
having those things is really great. So
Yeah.
how do we have, as a parent, how do we pick the right dentist to suit our children? Because a lot of us will just go to the dentist we're using.
Right.
But maybe the dentist we're using isn't great with children. What's a great way to go about that? Or is there child-specific dentists?
Well, there actually is actual pedodontists, and here in Moncton we do have one office that does do specific treatment for children. But a lot of offices are set up to treat kids as well, and I guess it's whatever the office meets your family's needs. And so from working in a family practice setting over so many years, I've seen kids come in at 6 and 7 years old, and now they're teenagers and on into their own adulthood, and some are bringing their own kids in, but they've developed that good rapport with the office. And I think so if you're looking for a practice, it's somewhere where you as a parent feel comfortable and you see that your child is being treated well and that they're enjoying their time there. So
Okay.
if that kind of helps to, answer a little bit of that, because if you as a parent are not feeling comfortable about the situation, then possibly that may not be the office for you and your children.
Okay.
Yeah.
Okay, excellent. So then maybe let's switch to brushing for a minute, because there are really great things that you'll find on the market, flashing toothbrushes
Yes.
that go for the length of time. Is it 2 minutes?
2 minutes, that's right.
Okay.
Yeah.
Okay.
Yeah, 2 minutes.
What are some other tips that parents should keep in the back of their minds?
One thing I think is really important, no matter whether your child uses or likes a power toothbrush or just a regular manual toothbrush, really in essence it becomes whatever you can do to get that toothbrush in your child's mouth on a daily basis 2 times. And so oftentimes very early on, when they start their teeth coming through and they're starting that teething process, having a toothbrush to be in there, getting a little baby toothbrush and having that in their mouth early on so that they can feel that. And even actually before that, from birth on, parents should be wiping their child's gums, either with a damp face cloth, or you can get a little covering that goes over your index finger that you can just wipe around. That cleans the milk out of their mouth, and so that helps with lessening the risk of decay later on. And so if they're used to having that rubbed around their mouth right from the early days through into their 6, 8, 9 months of age, once you get to that toothbrush time, that becomes something that is not like I guess something in their mouth that they don't know what it is, and then that becomes, sometimes they'll push kind of away from that. And I guess in the other part to that is that you don't need to put toothpaste from those early times on once their teeth start to erupt. Just simply water is all you need with a very soft baby toothbrush, and getting that in there. And now as they get into toddler years, sometimes that's when they can fight back a little bit and push back. And so we as parents have to be more firm and not so friendly by times, but having your child either lay down on the bed and kind of putting your arm over their little chest and arms and getting the job done is a more forceful way to do it if they won't cooperate. But it is necessary, because if you don't get that plaque off of there every day, the child is more at high risk for getting dental cavities as they get older. If they are more cooperative, definitely just, letting them have a toothbrush and you have a toothbrush. And so they have a turn and then mommy or daddy has a turn, and you can kind of go back and forth with that, playing games, singing songs, rhymes, counting, all of those things that toddlers really do sort of like to do and can relate to. That will definitely help them, sort of make it, again, a positive experience. And so then as they get on into their years, I still recommend, and I do for my own boys, I will still brush their teeth at night, take a peek, because at 10 and 12 years of age, they're there, but it's not the job that necessarily, if they do miss areas of plaque routinely, I know that decay will start, and they're going to end up with cavities on their teeth. So having them do more of a thorough job, reminding them, showing them spots that they're missing. And then once they get to that sort of 10, 12, 13 years of age, you can let the reins go maybe a little bit, but still checking in and looking inside their mouth will help hopefully prevent cavities from them.
Well, and it's amazing how fast, like I said, my girls have been going to the dentist a lot lately, which is really unfortunate. But I think I make them brush twice a day, but it's them that's doing it.
Right.
Yeah, and they're 6 and 9. So, like, especially my 6-year-old, there's no fun in brushing your teeth, right? Like, oh, sure, she's got the light up toothbrush,
right, yes,
and they've got the tasty, different colored
flavored
flossers and what have you.
Yes.
But nothing makes it more fun than just jumping into bed and reading a book.
Right. Exactly. That's right.
That seems to be the problem that we're having. So I need to find better ideas. We have the songs that we sing, and it's obviously just going to come down to me having to do it for them.
Right. Exactly. And again, my youngest son was very much, he was the one who pushed against me the most. My oldest son, has always sort of been more cooperative. And so I had to be that sort of put a little bit of extra force on to get that done. And still to this day, he's 10, and I still will go in the bathroom at night and I'll send him in to do it, and then I will take a peek after. And so we just have to, as parents, stay on top of them with that. And with the flossing, as you just mentioned, I mean, flossing is a key as well. Again, because, between their teeth, that's a common spot that cavities will actually start. Mm-hmm. And so by really, those little floss picks are really great for kids, because at that, once they're, 6, 7, they have the dexterity to be able to handle that. And so having them do that daily as well is a really important piece to that whole oral hygiene habits at home.
That was actually my next question. If you found that those little flossers are better than actual floss or about the same?
Really, the effectiveness, I can say, is about the same for kids, but the ease of using them is much easier than using a long string of floss, right? And so definitely floss picks, and as you said, there's flavors. Some of them, have, fun colors and that sort of thing. And so that is another sort of incentive to that. And so between that and, if they find their favorite kind of toothpaste that they really like, that again is important. And if I can just talk about toothpaste for one second,
actually,
when I mentioned
that's where I was going.
you're going
so
with toothpaste, okay, reading each other's minds.
Yeah.
I would say that we don't want to give a child toothpaste that has fluoride in it until they can spit.
Right.
And so, depending again on your child, it may be as early as age 3, but usually it's maybe around age 4 or so, when they have the ability to know that they don't swallow all the time, that they have to spit that excess out. And so you can buy toothpaste that has no fluoride in it. And so if your child is around that 2-year mark, age 2 or so, and they are giving you some challenges about brushing, sometimes the flavored of the bubble gum or the watermelon or strawberry can kind of help give a little bit more incentive to brush. And so, after you've, the baby teeth have come in and you've used the water, and maybe again it becomes more challenging, picking up some of the flavored toothpaste can help, just with no fluoride in it until the time that they can spit.
Okay. And so my youngest doesn't like mint toothpaste yet.
Okay, right.
She is still all about the flavors, which is understandable. She's 6.
Yes, yeah.
It's too spicy.
Spicy,
too
yes,
spicy.
that's what a lot of kids say, yeah.
So, but is that so Crayola, for instance, has got into the toothpaste and flossers market.
That's right.
Is it as effective if I was buying mint
it doesn't
Crest
matter.
or whatever, it doesn't matter. There isn't
no.
like more sugar in the bubblegummy whatever.
Not necessarily.
Okay.
No, not necessarily. As long as the child is brushing their teeth, and whatever sort of means it takes to get that done, that's really, and the effectiveness of getting all over all the surfaces of teeth really is key. And like I said earlier, power toothbrushes, some kids really love them. If they get their favorite cartoon character on them,
Yep.
that can really help, with that process. And then again, some kids are a regular manual toothbrush is just as good, and so whatever works to get your child the cooperativeness to get that to work, that's really, as parents, that's what we're looking for. So.
And do you think, like, say you have a child like mine who is not really cooperative with brushing their teeth, would you recommend a power toothbrush over a manual then?
Definitely,
Okay.
definitely. That can for sure help to, again, bring that incentive to do it. And there's so many of them on the market now. I mean, there's the kids brushes, but then there are, I should also add that a lot of the bigger dental companies have actually come out with apps that you can put on your phone. And so you bring your phone in the bathroom with you, and there's an app, and they win stickers if they brush for so long, and they can play little games. And so a lot of those things, and actually you don't even have to have the power toothbrush. You can just go on to those websites like Oral-B and Colgate and Crest and whatnot, and they will actually, you can download them onto your phone, and it makes, again, a great little incentive. And I think they click if they brush in the morning and they brush at night, and then after so many days they get so many points, or all those things that so again, those are things that kids can relate to, and that again can help have them more excited about brushing and flossing every day.
How do you think our parents survived?
I don't know.
They didn't have any of this stuff to make us do
this. I don't know. I guess it was just by.
They're
I'm not
stronger
sure.
than us, I
Stronger,
guess.
exactly. That's right. That must have been what it was.
Oh my gosh, that's so funny.
Yeah.
But I'm like, I'm gonna download all of these apps.
Oh, for sure,
And then
yeah.
I'm thinking, like, my mom's gonna be like, what is
Yeah.
wrong with you? You can do this,
That's right. Exactly. I know. But staying on top of it is definitely, more challenging with busy lives and all of these things. But
Yeah.
it's like anything. We prioritize what's important to us. Right?
Exactly.
And get it done.
Well, I mean, teeth brushing needs to be prioritized.
Right,
That's one
exactly.
thing you're teaching me right at this moment. Not that my kids don't brush their teeth, they do.
Right. Oh no, exactly.
Yeah.
But being thorough about it and taking the time to do it, because really, in essence, for baby teeth or primary teeth, those are the teeth that they are important, even though they lose all 20 of those. But by the time they get to their 14 years of age, those teeth hold the space for their permanent teeth to come in. And so there really is an important part or job that they have to do. And so, we don't want to see our children lose those teeth, or, have problems with those teeth, if at all possible. Now, there are lots of ways to, correct that with orthodontics, and, there's all of those things out there as well. But for basically, these baby teeth do have an important purpose.
Yeah, absolutely. But
Yeah.
that is a phrase that you hear a lot, though, right? Oh, they're just baby teeth, no big deal.
Right,
Yeah.
exactly. That's
Yeah.
right. And I know I explain to patients and patients' parents all the time, that we still want to keep those teeth as long as we can.
Well, and that's it. It's 13 years of those teeth, and that's a big phrase that I use to my kids. Actually, is that, like, these are your teeth forever now.
Right.
So we really need to take care of them.
Exactly.
And again, it goes in one ear and out the other, as
Yeah.
it does with most kids.
Right.
What about like south soothing, thumb suckers, finger suckers, even soothers?
Yeah.
Is there an age where you should stop these things? Like, should we ever be allowing it in the first place? I know that's such a controversial
Well,
topic,
it
but-
is, and
yeah.
I mean, when the baby's going to fall asleep, and they have their thumb in their mouth, and that's soothing them, and that's putting them to sleep. As an exhausted parent, leave it be. But once their permanent teeth start to erupt or come into the mouth, that's when we really want to watch that, because if they are thumb sucking, of course it can flare their front teeth out, and then that can have problems later on. So you know, we do monitor it from a dental perspective, that, you know, it could become an issue, sometimes with issues with the palate as well, and that kind of thing. So definitely, for sure, you know, we'll recommend to parents to try and break that habit, or take the soother away, you know, kind of cut those things. And so that sometimes, you know, is discussions that you have when the child is in, to have a cleaning and checkup done, that, you know, we would discuss and show the parents, and, you know, encourage them to try and have the child break the habit. But there are appliances out there for actually thumb sucking, because you can't take the thumb off, right? So you can take a soother away, but you can't take off a thumb. And so there are specific appliances that you can have made for a child, if that's so the case.
Okay.
Yeah.
Yeah. They, you know, the gross stuff that you can put on their thumb.
Yes.
My youngest just right through that. She could have cared less.
Funny.
And
yeah.
you know what? I remember my brother was a thumb sucker, and I remember my parents just going through hell to try to get him to stop.
Yeah.
And I remember thinking, like, I'm not going to put my kid through that. Like, the gross stuff on his thumb, and you know, it was the 80s, so they probably, no, my mom would kill me if I said this, but I was going to say they probably tied his hand behind his back. But no, they probably didn't. But like, I remember them being so upset about it. And so my youngest then turned out to be a thumb sucker, and the same thing. I can't cut her thumb off, so I'm just going to let it ride. But I can see her front two teeth and a narrow palate.
Right.
So I know I need to curb it, and I need to curb it soon. Like her very first dentist appointment, the dentist said, she's going to need braces. Get ready for it. Start saving now.
Saving now. Exactly. Yeah. Right. Exactly. And to that extent, you know, really, orthodontists do like to see children around age 7 or so, or 8. And you know, people say, oh, well, that seems so early. But in essence, those are the things that they can pick up at that stage. That sometimes an appliance can be a good thing to start out with. Whether or not that will eliminate braces down the road, not necessarily, but at least they can keep an eye on them during those developmental years, because a lot of what orthodontics does now is works with the child's growth. It used to be years ago, when you and I were kids, that kids, you know, braces would go on when all the permanent teeth were in, you know, 16, 17 years of age, 15, you know, around that age. Now they're saying, no, like, as this child is growing, and their jaw, their bones, everything is growing, we can use that to basically manipulate how the teeth are going to come in, when they're going to come in, and move those teeth appropriately depending upon growth. So there's a lot of changes within orthodontics that has really sort of helped that. So kids at 13 now are coming out beautiful smiles, because they've had all their permanent teeth in. They've probably been in ortho for 2 to 3 years maybe, but they've used that growth of that child through that process to do so. So
that's really interesting. Now, you've referenced appliances a couple of times. What do you mean by appliances? Like spacers?
Spacers can be one. Another common one is known as a palate expander. And so oftentimes, if children have very narrow palates, or on the top their top teeth is very narrow, our top teeth should be outside of our bottom teeth. And so if it's just with growth and the child, they can actually put an appliance that they snap in. It goes on their palate, and then as the child grows, the parent every second day turns just this little screw inside, and it just slowly opens, so that after, depending upon the length of time required to wear that palate expander, they will end up having their upper jaw will be wide enough and in the right place as they continue to grow. So that's and that among many others, but the palate expander is another common one. The spacer that you mentioned, that's oftentimes if a child loses baby molars and or a 6-year molar, a permanent 6-year molar, then they can sometimes they put a spacer in so that it kind of pushes things back or holds the permanent teeth in place, so that the other permanent teeth will come in front of it instead of too much crowding. Because if we're missing teeth, what happens is our teeth will tip inwards, and so with a spacer, it holds those permanent teeth out where they're supposed to be, so that the other teeth can come in appropriately. So those are a few of many different.
Yeah. options.
Yeah.
I have learned so much today, but Charles is telling me we're out of time. So,
Very
so
good.
before we go though, at Oulton College, you guys
Yes.
are always looking for clients, right?
We sure are.
So
Yes,
how would
definitely.
people get a hold of you guys?
You can definitely give the dental center a call at 858-8484, and our receptionist would love to book in your children. We're always looking for children as well as adults too, but oftentimes it's a little harder to get kids in. So you know, we love to have kids in. Our students do need to have do have requirements for children. And so you can definitely give us a call. We also have a dental sealant clinic. So dental sealants are basically a preventive form of preventing decay in the permanent teeth. And so that's a clinic that we do February, March during the winter. So that again, if you children have not had sealants, we'd love to have them in for that too.
Okay.
Yeah.
Sign us up. We'll be there. Sure. The Taylor kids will be there.
Sounds good.
Okay, Alison, thank you so much for that wealth of knowledge.
Well, thank you for having me. It was good.
Awesome.